Welcome to our educational talks for Cardiac Rehabilitation, Swansea Bay University Health Board. The topic that we are going to cover today is understanding treatments for coronary artery disease. During this presentation, we will look at the most common treatments available, like angioplasty and stents, coronary artery bypass grafts, and medical management. Disclaimer: this presentation should be used for general information purposes only. It is not a substitute for specific medical advice from a GP, specialist, or other healthcare professionals and should not be used as such. For individual cardiac rehabilitation advice, please consult your local cardiac rehabilitation team. If you are experiencing any changes in symptoms, please seek advice from either a GP or specialist. In the event of severe chest pain or breathing difficulties, please dial 999. We will be looking at the following treatments for coronary artery disease: angioplasty with stent and/or balloon, coronary artery bypass graft, and medication. We will start by looking at stent with balloon angioplasty. In diagram 1, it shows a build-up of cholesterol partially blocking blood flow through the artery. In diagram 2, a stent with a deflated balloon and a collapsed stent is inserted into the partially blocked artery. In diagram 3, the balloon is inflated to widen the artery by squashing the cholesterol up against the coronary artery wall, and also expands the stent into position. In diagram 4, it shows that the balloon has been removed from the expanded stent. This is done by deflating the balloon before removal. Coronary artery stents are a small, self-expanding wire metal mesh tube. It is placed inside the coronary artery after balloon angioplasty. Once deployed into a coronary artery, it will never move or be removed. Most common stents are around 15 to 20 millimeters in length, but can vary from 8 to 48 millimeters and are about 2 to 5 millimeters in diameter. Stents are used depending on certain features of the artery blockage. For example, if the blood vessel is too big or too small to put a stent in, or if the person is allergic to the material in the stent, which is rare. If the diseased artery is not suitable for stenting, then a balloon angioplasty alone can be performed. This is where the balloon alone is inserted into the partially blocked artery and is repeatedly inflated and deflated to squash the cholesterol back onto the artery wall, making the coronary artery wider than previously. This is then removed without any stent being deployed. This is a different view of a coronary artery stent being deployed, and as you can see, the balloon is still inflated and the stent has been expanded. Image A shows the catheter with the deflated balloon and collapsed stent on it. Image B shows the inflation of the balloon and the expansion of the coronary stent. This image shows a picture of a stent that has been embedded within a paperweight, so it does make it look slightly larger than what it actually does. This can be shown to patients at Morriston Hospital who are waiting for an angiogram, who may need or have had a stent inserted. A coronary artery bypass graft is a surgical procedure used to treat coronary artery disease. The aim of this surgery is to improve blood flow and oxygen supply to your heart muscle by bypassing, so sending blood around, the blocked part of the artery. Coronary artery bypass graft surgery usually lasts 3 to 6 hours, but it may take longer depending on how many blood vessels are being attached. Blood vessels can be taken from your leg, inside your chest, or your arm. This new blood vessel is known as a graft. The number of grafts needed will depend on how severe your coronary artery disease is and how many of the coronary blood vessels are narrowed. Most people get excellent relief from angina and improved quality of life following this surgery. The risks of heart bypass surgery are different from person to person, depending on the severity of heart disease, type of operation, age, and current state of health. You should be out of bed in a day or two and return home after a week, with full recovery after 2 or 3 months, depending on your fitness, age, and how severe the problem was. Follow-up with your surgical team is usually between 6 to 8 weeks after discharge. If you drive, you will need to refrain from driving until you have had the all clear from your surgical team at this appointment. You should receive a call from your local cardiac rehabilitation team soon after discharge home, who will help guide you in your recovery. For some people, your doctor may feel that angioplasty, stenting, and surgical intervention is not an option and wish to treat your symptoms with medication alone and monitor. The following medications are the most common used for treating symptoms of coronary artery disease. Not all people will be able to tolerate the medication on this list, and alternatives can be prescribed. Your local pharmacists have a wealth of knowledge on these medications, and if you have any questions or concerns regarding your medication, then they are a good resource to tap into. If you are having any unwanted side effects you believe are being caused by your medication, please do not stop taking your medication until you have spoken to your pharmacist or doctor and agreed a suitable regime. If you wish to look at these medications in further detail, please refer to the link for the British Heart Foundation website. The medication at the end of this list is called glycerine trinitrate, abbreviated to GTN. This comes in a spray or tablet form and can be used to quickly treat angina. If you have not been prescribed a GTN spray or tablet and are known to have heart disease, please speak with your doctor or pharmacist to discuss. Lots of people ask us, what do I do if I have chest pain again? The following information is for people who have been prescribed a GTN spray or tablet for angina symptoms. However, if you do not have a GTN spray and you experience chest pain you believe is coming from your heart, then please access help via your GP or 999. Do not ignore this. If you experience pain or discomfort that you feel is coming from your heart, please take a seat and rest. If this does not subside after a minute or two, then use your GTN spray or tablets as follows. For this example, we talk about using the GTN spray. Step 1. Spray 1 to 2 puffs under the tongue and wait 5 minutes. If your symptoms become severe or worsen during this time, dial 999. If the pain eases, then rest for 10 minutes before getting up, and this may make you feel a bit lightheaded. If after the first 5 minutes the pain is still present, then move to step 2 and take another 1 to 2 puffs of GTN under your tongue and wait 5 minutes. The rules are similar as previous. If symptoms become severe or worsen during this time, dial 999. If the pain eases, then rest for 10 minutes before getting up. If the pain is still present after the second 5 minutes, then dial 999. Do not drive or go to hospital in a car. Following your heart event, you should be referred to the cardiac rehabilitation team and receive a telephone contact post-discharge from them. This service offers exercise, health education, and well-being support. The aim is to help you recover and resume a normal life as soon as possible. Research has shown it can reduce the risk of having another heart event and help you address any risk factors that are linked to coronary artery disease that you might have. If you have not heard from your local cardiac rehabilitation team following a recent cardiac event, please ring your main hospital switchboard and ask to be put through to the cardiac rehabilitation team. It may be that they have your referral and haven't been able to contact you just yet, or it may be that you were not referred to them due to an oversight, or for some areas they may not be funded to see certain diagnoses. Most cardiac rehabilitation teams are made up of a number of professionals, and each area may differ from another. The disciplines can range from nurses, physiotherapists, physio assistants, exercise instructors, occupational therapist assistants, psychologists, and receptionists. If you wish to do some further reading or find out what other education material is available, please refer to the following websites. Thank you for watching. Any questions, please contact your local cardiac rehabilitation team.